Hello everyone. Thank you for joining us today for our webinar entitled ImageSmart, an Allscripts certified CDS solution. Today's presenters are Lindsay Mack, ImageSmart Senior Product Manager, and Steve Simpson, the Director of National Accounts. My name is Liz Jones and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. With that, I will turn things over to Lindsay.
Thank you, Liz. Good afternoon, everyone on the line. As Liz said, my name is Lindsay Mack, and I'm the Senior Product Manager here at Allscripts Institute for the ImageSmart solution. I have the pleasure of overseeing the implementation and the development of the ImageSmart solution and working directly with our client partners on a daily basis. Today, I'm excited to introduce you to the ImageSmart solution and share with you the impact we've seen from the utilization of ImageSmart in the provider environment. Our objectives for today include provide you with an introduction to Allscripts Institute, introduce the PAMA legislation, introduce ImageSmart, and again, the impact we've seen in the field. Let's get started with a little bit of background on Allscripts Institute and how ImageSmart came to be. Allscripts is a healthcare nonprofit with a mission to serve the public good by advancing health and healthcare at every level, including all the way down to the provider. We are a solution provider to over 150 clients nationwide since 1946. We're headquartered here in Ann Arbor, Michigan, with additional locations in Washington, D.C., Maryland, and Rhode Island. Allscripts offers expertise in sustainable improvement across the healthcare continuum. We offer many solutions to our clients, including a national depression registry that services many major healthcare health systems across the nation, including Johns Hopkins, Mayo, Cleveland Clinic, University of Michigan, and others. We offer to physician organizations within the state of Michigan care coordination regarding children's oral health, working directly with a pediatrician and dentist, ensuring that children are receiving optimal care. We also cover many other areas, including elder care and advanced illness, clinical research, and providing survey research services across the United States. We also have a long partnership and history with CMS, serving both as a think tank and an innovation center. We spend a lot of time providing input into strategic new legislation as well as the actual implementation of that legislation in working with CMS. ImageSmart was a result of that ongoing partnership that we have with them. To provide a little bit of context around the reason for ImageSmart and the reason why it's important, let's take a look at the changing healthcare market. As I'm sure you're aware, in 2010, meaningful use was introduced. We've seen a stepped approach to the meaningful use implementation starting in 2010, moving all the way through 2017, each phase introducing new aspects of change to the healthcare space, focusing on a change from volume and quantity to quality and value. Each phase has held significant changes not only in how care is delivered at the provider level, but also at the organization level regarding reporting and reimbursement changes. In 2011, layered into meaningful use, the Centers for Medicare and Medicaid implemented a new CMMI grant. Its focus was a process of vetting the utilization of clinical decision support for advanced diagnostic imaging at the point of care. The goal was to ensure the use of clinical decision support was actually reduced unnecessary or inappropriate imaging in the provider workflow and to determine the most effective approach to the implementation in the provider setting. The problem that CMS was trying to solve, that it found through an evaluation, was that 15 to 30% of advanced diagnostic imaging had been reported to be inappropriate or unnecessary. It also found through a claims analysis that $16.8 billion spent by Medicare was specifically on imaging services in 2013. This means that close to 1/3 or $5 billion of Medicare money spent on imaging services was inappropriate or unnecessary. They also found in this study that 13.2% of total Medicare spending took place in the ambulatory setting. The goal and the hope of the CMMI grant was to target primary care physicians, specifically in the ambulatory setting, to better support them to make a necessary and appropriate advanced diagnostic imaging order decision for their patients in reducing healthcare costs. Allscripts was awarded a role as a partner in the CMMI grant in 2012. Part of our job was not only to build and implement a clinical decision support at the point of care with a focus on supporting the ordering professional, the patient, but also reducing healthcare costs. In this process, we were also active participants in helping CMS review the PAMA legislation of 2014. The PAMA legislation, or Protecting Access to Medicare Act of 2014, was focused on reducing inappropriate imaging through the utilization of clinical decision support. This was introduced in 2013, and from 2013 to 2015, we were actively involved in providing feedback on both the details of the legislation and the implementation in the provider setting. The legislation highlights that for the ordering of an advanced diagnostic image, an approved clinical decision support mechanism or solution must be utilized that contains CMS-approved evidence-based guideline criteria. As partners with CMS in this process, ImageSmart was fully designed and built not only with the ordering professional in mind, but also to support the patient and to be fully compliant with this new legislation. Looking ahead, we are now in the implementation phase of PAMA. In the legislation, it states that PAMA will be fully in effect as of January 2017. Now, we do believe that that date will be pushed to January 2018. However, the date for full compliance and accountability is January of 2020. This compliance phase means that providers will be reviewed to ensure that a clinical decision support solution is being utilized in the ordering of advanced diagnostic image orders and that it's being done appropriately. Let's take a look at ImageSmart. ImageSmart is a point-of-care clinical decision support solution for advanced diagnostic imaging. As I said before, we built it fully to support the ordering professional, understanding that through the grant process, our ordering professional had specific needs from the assessment and plan to the order and the initiation of the order in the electronic health record. We understood through this grant process that the patient also had needs. So our goal was to provide them with appropriate care and a collaborative decision-making tool with their ordering professional. We also provide them with patient education material. Our goal was also to support Allscripts, TouchWorks, and professional clients with a focus on improving their overall quality metrics and maintaining government compliance. We also had a focus on seamless integration with the electronic health record, understanding that to fully support the provider at the point of care, we needed to be implemented and integrated in with the EHR. So let's take a look at some quick highlights of how we built ImageSmart to support all of these different aspects. In 2012, as I said, The CMMI grant was awarded and we became partners with CMS for the implementation of a clinical decision support tool. We began to form partnerships in 2012 and 2013, focusing on government-approved evidence-based criteria partners such as the American College of Radiology and American College of Cardiology. We also formed a physician steering committee, recognizing that we needed constant feedback from physicians in the community to ensure that we were meeting their needs correctly. We also instituted an iterative feedback cycle where we constantly had mechanisms of feedback where we were receiving input on design and development of the solution. We also instituted ways to measure how effective the tool was in the provider environment. This went into 2014 as well as 2015, a constant process of both design, development, implementation, and evaluation. We implemented many user surveys, patient surveys. We did a retrospective study to fully understand the impact of ImageSmart in the provider environment, as well as doing claims analysis. In 2014, we finalized our partnership with Allscripts. We were very excited in the selection of Allscripts as our initial partner for the electronic health record integration. Allscripts had proven that they were leaders in the market in terms of integration with their open marketplace and the level of integration that we could integrate into the EHR, ensuring that our end users' experience was as optimal as possibly could be. In 2015, we completed our Allscripts development and became fully certified for both Professional and TouchWorks. And again, our iterative feedback process continued, as well as our evaluation activities, always keeping a tap on if the development work we were doing was both relevant clinically and supporting the ordering professional as much as possible. Today, we continue this process of both development and feedback, as well as additional activities as attending user groups, doing educational webinars around the legislation and how you can best be prepared. Our goal is to continue to partner with provider organizations, ensuring they are always ready for the future. In this process of development, we came across a set of solutions that were important to our provider organizations. So we knew that supporting new reimbursement requirements for advanced diagnostic imaging was something of value. If we could somehow solve that problem and make it as seamless as possible, we would be supporting our organizations. We are happy to say that we were able to develop ImageSmart in a way where we fully support these new requirements by ensuring the data gets back into the EHR. We also knew that it was helpful to ensure an organizational compliance to PAMA. As a partner with CMS, we can say with confidence that we fully support the new legislation. We also understand that there are major initiatives regarding quality metrics and PQRS reporting, so it was in the best interest for our providers to ensure ImageSmart also supported those efforts, which it does. We have a point-of-care access to current evidence-based guidelines. As part of our development process, we continue to ensure that ImageSmart only uses the most recent evidence-based guidelines, and we have a constant process of review and updating those guidelines. We took the approach of incorporating clinical decision support directly into the provider workflow, understanding that the provider needed quick access in the assessment and planning process all the way to the initiation of the order, understanding that it was important to support the ordering process to the best of our capability. We also ensured that providing EHR integration and user-friendly workflow was also of great importance to us. And last but not certainly least, how do we engage the patient? Ensuring the ImageSmart solution engage the patients with the physicians in shared imaging decision-making by providing them with information about procedure costs, radiation exposure, as well as patient education materials. So let's talk about proven results. As I said before, we had a constant rapid cycle iterative process where we constantly were receiving feedback from our users, as well as an evaluation process. Going back to the numbers that I mentioned at the beginning, CMS had identified that 15 to 30% of advanced imaging orders had been reported to be inappropriate or necessary. As the ImageSmart team conducted a retrospective study, we found that with the use of ImageSmart, we saw a potential population cost savings of 15%, which is a significant cost savings. If CMS is reporting a 15 to 30% of inappropriate or unnecessary, using a clinical decision support tool would make a significant impact in cost savings. We also experienced an additional positive impact around one of our physician partners. They're a large physician organization, for the first time receiving an incentive payment around imaging. They had never received an image reduction program incentive ever in their history. With the utilization of ImageSmart, not only did they receive an incentive payment of over $800,000, they also changed their rank in terms of the worst quality into somewhere in the middle of the pack, recognizing that while they had made significant changes, there was still work to be done from a quality perspective, and they've continued to remain committed to that initiative. So we were very excited, as were they, about their results. We also saw, from the ordering professional perspective, there was a 20% of change in ordering behavior. There was also 11% increase in the selection of a more appropriate test. Again, all of these pointing to an increase in quality and an increase in appropriateness of ordering, again, achieving the goals we had set out to obtain. An unexpected but positive impact that we were happy about was that there was an administrative impact. There was a reduction in time spent for prior authorization due to increased initial submission approval rates. This means that using ImageSmart, any office manager or nurse who had to call for prior authorization, they had all the information they needed at the right time to quickly receive their approval, thus reducing administrative overhead. So all these were very exciting, and it was great to see that we were actually making change in the area of advanced diagnostic imaging. So at this time, I believe we have some questions.
We do. There are a few questions. First, how long does it take to install, and what types of resources are needed to implement?
Sure. Installation and implementation of ImageSmart. So just to provide some context around ImageSmart, ImageSmart is provided in both a web and mobile format, fully integrated into the EHR. It takes less than 4 weeks, and client resources in terms of how much time your team has to invest is less than 20 hours. We often find that it's more around the 10-hour mark. The only resources we require initially are an IT administrator to assist with a short round of testing. We do everything from ensuring your own instance of the application to also ensuring it's activated within your Allscripts environment, and then doing some testing with your IT administrator. And then we only need some clinical champions for training. So again, less than 20 hours, and it's typically a very quick turnaround.
When is the estimated effective date for the mandate around using CDS for imaging?
Steve, I'll let you answer this one.
Yeah, sure. Thanks, Lindsay. Yeah, so it hasn't been formally announced yet, but the best guess for implementation of the new mandate around appropriate use criteria for advanced diagnostic imaging is January of 2018, and Lindsay did address some of that in her earlier slides, so I'll let her comment further.
Sure. When the legislation was initially introduced, it was introduced with a January 2017 effective date, meaning that for the ordering of the advanced diagnostic image, it would be required to use clinical decision support that was both approved by CMS, and in that approval, it meant that you were utilizing approved content by CMS. To date, as we've continued to work with CMS on the legislation, we were at a meeting in March. They are still working on the identified content sets they want to have listed as approved. We do know and are confident that the ones utilized in ImageSmart are on that list, but again, CMS is still finalizing that decision. So because of that, we anticipate that it will be January 2018.
Do you have to have an Allscripts EMR?
You do not. So ImageSmart, if you have an additional EHR or a separate one, we can talk with you about how to integrate most effectively with that EHR. Or if you would just like to use a standalone web instance of ImageSmart, that is also a possibility.
We're interested in seeing a demonstration of ImageSmart and how it integrates into our Allscripts EHR. How do we go about scheduling?
Yep, so this is Steve. Yeah, we'd welcome the opportunity for a personalized presentation of ImageSmart and how it integrates with Allscripts. So you can contact myself, Steve Simpson, or Lindsay Mack, and the following slide will provide our contact information. Or you can just type a message in the chat box here, and we will follow up promptly and get that scheduled.
What is the learning curve for training providers on ImageSmart?
That's a great question. Our experience with providers is because ImageSmart, we've spent so much time from a usability aspect, the majority of providers that use it have picked it up very easily and very quickly. From a training perspective, it typically takes about an hour, sometimes 2, depending on skill level with the computer, to train a provider, but we find the uptake rate to be very quick. And often our experienced users, it takes them less than 2 minutes. Often it's more like a minute to actually complete the clinical decision support process. From the different types of training that we offer, we can provide a webinar training, a recorded webinar, a live webinar. We could even do a train the trainer, so we train a set of your staff. Or we can come on site if you're a larger organization, or even if you're not and you would just like on-site support, we'd be happy to do an on-site training with you.
What sources do you use for the latest evidence and best practice recommendations?
Sure. That's a great question as well. Currently, to date, we have 2 modules within ImageSmart. We have our general radiology module, which utilizes content from the American College of Radiology. We also, in our second module, we have a cardiac module, and we utilize content from the American College of Cardiology. Layered in on top of both content sets that we utilize, we provide additional nationally recognized best practices to help fill in the gaps of some of the content sets. This is one thing that we do differently than some of our competitors, is we actually seek to fill out the content where we've identified that it's weak. Our physician steering committee has done a detailed review of the content and has actively worked with us to strengthen the content set where necessary. Because our goal is to provide our users with the best recommendations possible and the most knowledge as much as possible. So our core content sets, again, American College of Radiology, American College of Cardiology, and then layered in our additional nationally recognized best practices.
Okay. I think that is all of the questions we have for now. If we have missed anyone's questions, we will email you directly with an answer shortly. Thank you, everyone, for attending, and have a great day.